beautiful and big country. I have the pleasure today of being in the company of Minister Gould, who is Minister of International Development, Minister Qualtrough, Minister of Employment, Workforce Development and Disability Inclusion, and Minister Aidu, Minister of Health. So we'll turn to them each in turn, starting with Minister Gould.
Great. Well, thank you very much, Jean-Yves, and good afternoon, everyone. It's good afternoon here in Burlington. Over the course of the last year, Canadians have come to understand that our domestic and global responses to the pandemic are inextricably linked. Today, during a meeting of G7 leaders, Prime Minister Trudeau announced $75 million in new funding toward international vaccine procurement, distribution, and delivery efforts aligned with COVAX and the Access to COVID-19 Tools, or ACT, accelerator. Since the early days of the pandemic, Canada has known that we must vaccinate Canadians, while also ensuring that the rest of the world has access to safe and effective vaccines too. The most effective way to protect all countries is to pool support for the development and manufacture of COVID-19 vaccines. That is why we helped establish the COVAX facility. The COVAX facility reflects our common goal of ensuring that safe and effective COVID-19 vaccines are affordable and available to everyone. Overall, Canada has mobilized over $2 billion in international assistance in response to COVID-19. That includes $325 million to COVAX to give low and lower middle income countries access to vaccines. Canada joined COVAX as a self-financing participant from the beginning. The COVAX facility needs countries at all income levels to invest in this coordinated global effort. At
the G7 meeting today, the Prime Minister applauded the contributions of other leaders to Act A and COVAX in order to allow equitable access to vaccines and diagnostic and therapeutic solutions. In a few short weeks, countries around the world will be receiving their first doses of the vaccine via COVAX. This will allow them to begin to vaccinate healthcare workers and high-risk populations. It's an incredibly complex situation, but we cannot lose sight of the fact that we have come from so far with regard to the development of medical solutions and access for everyone everywhere. This is the start to put an end to the pandemic. Vaccines, tests, and treatments are a central part of Canada's international response, but our efforts go far beyond that.
Effects on gender equality, food security, and nutrition, health systems, and economies, all reverberating from the impact of COVID-19. We need to ensure that development gains made over decades are not lost. One thing is for sure, Canada is committed to helping countries everywhere recover from the pandemic and to rebuild a more inclusive world. Thank you. Merci. Back over to you, Jean-Yves.
Thank you, Karina. Minister Qualtrough.
Merci, Jean-Yves. Hello, bonjour tout le monde. Je suis heureuse de me...
Good morning, everybody, or afternoon. I'm pleased to be here today to talk about our plan to continue to support workers throughout the pandemic.
Recovery benefits and flexibilities to the EI program. We said that we would monitor labor market changes and make adjustments as needed. We're still very much in a time of crisis. Restrictions are in place across the country to slow the spread of the virus. We know this is still a really difficult time for many workers and their families. Today's announcement reflects this reality. Nous avons évalué.
We assess the current labor market, and we are respecting our commitment to continue to offer certainty to workers.
Today, we are pleased to announce that we're going to increase the number of weeks of benefits available for the Canada Recovery Benefit, the Canada Recovery Sickness Benefit, the Canada Recovery Caregiving Benefit, and Employment Insurance Regular Benefits. As some workers could begin exhausting their benefits in late March, this increase will ensure continued support as Canada's economy and labor force continue to recover. We'll be increasing the number of weeks available under the Canada Recovery Benefit and the Canada Recovery Caregiving Benefit by 12 weeks, thus extending the maximum duration of the benefits from 26 weeks to up to 38 weeks. And we'll be increasing the maximum number of weeks available under the Canada Recovery to 4 weeks. We will make these changes through regulation. We also intend to increase EI regular benefits. Workers will be eligible for up to 50 weeks for claims established between September 27, 2020 and September 25, 2021. This change will have to be made through legislation. Collaboration by opposition parties will be important in ensuring this continued support. When we've worked together in the past, we've delivered key supports to help millions of workers. Canadians expect the same of all parties again. Ensemble,
Together, extending regular EI benefits and recovery benefits are what Canadians need to get through this difficult period.
merci.
Merci beaucoup, Carla. Can
Thank you very much, Carl.
I to Minister Aidu?
Oh, thank you very much, Jean-Yves, and good news from our colleague, Minister Qualtrough, because of course there has been good newsing across the country. We heard Dr. Tam's modeling this morning about Canada's projections, but we can't let up our measures as of yet. As Dr. Tam said, the virus is still with us, it's still in communities, and that means we still need to remain vigilant. Today's modeling also demonstrated how the variants of concern can put communities and people at risk. But we know that the things that work for COVID work for variants of concern as well. That is, wash your hands, wear your mask, make sure that you stay home when you're sick. These are the kinds of things that we know work to contain COVID-19 in our communities and protect our families. Now, what I'm asking everybody today is to keep up their hard work. And I know that's a hard message to receive because people have been trying so hard to follow public health measures, to live in new ways, to work in new ways. And we appreciate all of that effort. And I know that family members and communities do too. We do see the light at the end of the tunnel. Major General Danny Fortin said yesterday we expect to receive 22.8 doses of the Pfizer and Moderna vaccines between April and June. So we can see that vaccines are arriving week over week. Communities all across the country are vaccinating those most at risk of dying from COVID and healthcare workers and a variety of other vulnerable people. But while everyone waits for their vaccine, we need to continue to protect each other with the measures that we have in place. Now, also yesterday, my colleague Minister Lametti introduced proposed changes to the Controlled Drugs and Substances Act and the Criminal Code. If passed, these changes would change sentences for drug offenses under the Criminal Code. Now, I'm talking about this because it's so near and dear to my heart. People who use substances have been, as you know, over many centuries, stigmatized and face an enormous amount of discrimination in their everyday lives. And we know that the time has come to talk about substance use as a primarily health issue rather than a criminal justice issue. It's very important because so many families are living with the challenges of a loved one who has used substances in a problematic way, and the changes that Minister Lametti is proposing will shift the conversation to ensure that we support people who use substances to get the supports they need and to get the help they need to deal with their problematic health issue. So thank you very much for listening today, and please stay safe.
Merci beaucoup.
Thank you very much, Patty. Now we would be delighted to respond to any questions.
Thank you. The ministers will now take questions over the phone. Operator, over to you.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from, la première question est de l'inaudible de la presse canadienne. Please go ahead, à vous la parole.
Oui, bonjour.
My question is for you, Mr. Duclos. Monday, the measures with regard to mandatory quarantining at a hotel come into force, and there has been a phone registration system put in place. It's Friday. The first people coming Monday should have a hotel, and they can't get through the line to make the reservation. Thank you very much for that question. Two things in response. The plan is that everything is in place on Monday, as you indicated, so that the new border and quarantine measures can be in place as we speak. There are significant efforts being made by government technicians to ensure that the system is working, and there will be news and developments as quickly as possible. Could you please explain why you gave this to a phone service run by American Express, if I'm not mistaken, rather than an online service? It's American Express Global Business Travel instead of an online service. It's an excellent question. In order to have a good answer, I think that my colleague, Patty Haidu, is listening attentively, and she is probably prepared to provide some better specifics in English.
Kathy?
Thank you very much, Jean-Yves, and I was listening attentively. The object of the work of the Public Health Agency of Canada to prepare for supporting the quarantine of returning travelers was to work with qualified companies that had the capacity to quickly stand up the tools that we needed to do so. I want to take a moment to thank, for example, the number of hotels and hotel associations who have been serving in phenomenal ways to help provide shelter for folks in communities that are experiencing homelessness through this, helping us with quarantine of a variety of different ways, and most recently have stepped up with the enormous task to provide quarantining for returning travelers. And I'll also just remind Canadians, now is not the time to travel. If you don't absolutely need to travel as a condition of your work, please reconsider. It is not the time to travel, and we ask all Canadians to continue to push through and make these sacrifices for one another.
Thank you. Next question, please.
Thank you. Merci. The next question is from La prochaine question est de David Thurton from CBC News. Please go ahead. À vous la parole.
Hi, yes, there have been lots of complaints about accessing the sickness benefits. So I'm just wondering, Madam Qualtrough, if there's anything that your government is considering doing to make sure that this benefit gets into more hands of the Canadians who need it.
Well, thanks for the important question. You know, paid sick leave has been a key component of our public health response from the beginning. It was an eligible under CERB, and then we highlighted it in our Safe Recovery Agreement with the provinces, and of course with the Recovery Sickness Benefit. We've been supporting workers who are sick or have to isolate or quarantine because of COVID. We remain absolutely committed to supporting workers. We created the sickness benefit to protect them and to protect their workplaces. We said in August when we created these recovery benefits that we would indeed keep an eye on the labor market. We've heard that a lot of frontline workers, for example, have exhausted the first 2 weeks we offered, so we're adding 2 more weeks. But we also expect provinces to do their part. And provinces still really have a leading role to play in supporting workers. Not to duplicate our efforts, but to complicate. You know, we've got good examples in BC and Yukon, and I would just urge provinces to kind of step up for workers and do their part like some of their colleagues have. Thank you.
Follow up?
Totally different question, Minister Gould. Your government has faced criticism about donating to COVAX and withdrawing from it, even though, yes, you are eligible. The system is set up so that it helps poor countries and also countries in positions like Canada that are wealthier. But would your government reconsider drawing upon its allocation from COVAX?
So thanks again for the question. And again, I think it's really important just to reiterate how and why COVAX was set up. I mean, COVAX was specifically set up with the intention to have both wealthier countries contribute both as donors, but also as purchasers of vaccines to actually make the mechanism work. And Canada was, in fact, the first country to donate to COVAX, help set it up, get it off and running. And so we have been a huge, huge supporter of COVAX, and it requires both wealthy countries to purchase vaccines through the mechanism, as well as make a donation to both increase the purchasing power of COVAX, as well as to support and to subsidize doses that are going to lower income countries. So it is a really important mechanism. We're very proud to have played a founding role in its creation and to be one of the top donors and to see it to be a success.
Thank you. Next question, please.
Thank you. Merci. The next question is from La prochaine question est de Adina Bresti, the Canadian Press. Please go ahead. À vous la parole.
Hi there. I think that my question was just asked. So, yeah.
Thank you. Next question.
Thank you. The next question is from La prochaine question est de Alison Northcott from CBC News. Please go ahead. À vous la parole.
Hi. We've been hearing from people looking around the hotel quarantine, looking for exemptions for various reasons who are coming back to Canada. And they're saying that it's hard to find the information, that the details for exemptions on the website aren't clear. And so I'm wondering if you're going to be putting out a more detailed list of exemptions and how someone could apply for or find out if they qualify for an exemption.
Well, thank you for the question. And I think our government has been extremely clear that very few exemptions will be consented to, and they're really related to essential travelers that we have been very clear about for a very long time. However, having said that, the information is on the Public Health Agency of Canada. There is a chart in terms of types of exemptions and why. I will just say this, the quarantine is in place for a very important purpose. It allows for the clearing of a PCR test for a person to be tested for COVID and for Canada to receive the results of that test prior to any onward travel. It also allows for any positive tests to be tested or sequenced, if you will, for any variants. It's very important right now that we understand what the virus looks like as it changes and as it shifts, both here domestically in Canada, but also in an international context, so that we can continue to monitor COVID in Canada.
Follow up.
I'm also curious about the price. The $2,000, is it necessarily $2,000, or does it depend on the hotel? And what happens if someone is unable to afford that?
There are the hotels are doing the billing directly, and different hotels will have different rates. In fact, travelers can look at the website, which will give them more information about the variety of different hotels that are offering bookings. The hotels are setting the price based on their own deliberations on their own expenses, and so again, the cost of the stay may vary. In terms of returning travelers, people need to be prepared for the additional expense of quarantining in a federal facility for up to 3 days.
Thank you. Next question, please.
Thank you. Merci. Once again, please press star 1 if you have a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. The next question is from La prochaine question est de Annie Bergeron-Olivier, de CTV National News. Please go ahead. À vous la parole.
Hi there. Thank you so much for taking my question. Apparently, Pfizer has asked the FDA to consider the ability of storing the Pfizer vaccine at a much higher temperature. So instead of the deep freezers, it seems that Pfizer now has evidence it might be okay in a regular freezer. I'm wondering if Pfizer has made the same request of Health Canada, and what kind of data you have that Pfizer may be able to be stored in a regular freezer and not the ultra deep freezers.
Thanks for the question. I was just speaking to my team about this prior to the question, and in fact, they are in conversation with Pfizer. Pfizer has not applied yet to Canada for that regulatory change. However, we stand by ready to assess it when they apply. Obviously, we're monitoring the situation very closely.
Follow up.
Yes, and sort of along the same vein, there has been a lot of discussion recently about the fact that the Pfizer could be just as effective with one shot instead of two. I'm wondering what discussions have you had with Pfizer about that? And if it is in fact able to be one shot and could be in a regular freezer, what kind of a change could this be? Would that be considered almost a game changer in Canada?
It could be for sure, and the regulators are, always reviewing the new data as it arrives from both the manufacturer, but our own domestic data that continues to grow. And so, of course, if the company decides to change its dosing schedule, they would apply to Health Canada, and we would review their data closely and then make any regulatory changes based on the data that the company is asking Health Canada to review.
Thank you. Next question.
Thank you. Merci. The next question is from La prochaine question est de Bill Curry from the Globe and Mail. Please go ahead. À vous la parole.
Hi, this is a question perhaps for Minister Gould. We asked the Prime Minister a question about the World Health Organization's request that once wealthy nations have vaccinated their elderly populations and the most vulnerable, that then they should start sharing their vaccines with developing countries, poorer nations. And he said absolutely. So I just wanted to confirm that is actually the plan that Canada has to share its vaccines, even though all of Canada won't be vaccinated at that point, and how exactly that would work. Is there specific thresholds for triggering that switch?
Well, thank you very much, Bill, for the question. I mean, I think one thing that's important to note is that through COVAX, I mean, we are working to ensure that vulnerable people, high-risk people, healthcare workers in developing countries will be vaccinated as soon as possible. COVAX has sent out their allocations to member countries and will start delivery in the coming days and weeks. So I think that's, a really important starting point. And COVAX is working as it was intended to. So that is a really good start. As the Prime Minister has said already back in December, Canada is committed to donating our excess doses. We are still working through when and what that would look like, but those conversations are very live and ongoing. But we, our objective is that no dose goes wasted, and so we will ensure that we do donate our excess doses. And in fact, one of the things that I announced back in December was $5 million for COVAX to set up a vaccine exchange and donation mechanism so that we have the legal and logistical structures in place to ensure that countries can safely and effectively make those exchanges.
Follow up?
That adds a bit of confusion, though, if you don't mind, because you're talking about excess doses, which would imply sharing after all Canadians have been vaccinated. But the Prime Minister seemed to be agreeing with the idea of sharing vaccines when just vulnerable and elderly have been vaccinated, but other Canadians still have not yet been vaccinated. So can you clear that up, please?
Yeah, so as I said, we have committed to share excess doses, and the conversations about when that would take place are ongoing. We are obviously, relying on officials from Health Canada who, are making these determinations. Our, top priority is ensuring that Canadians have vaccines, but at the same time, we have also been leaders on the world stage when it comes to equitable access on setting up mechanisms like COVAX and ensuring that those mechanisms are in place when donations and exchanges are ready to take place.
Thank you.
Maybe, Karina, I can jump in here and just add a little context. Those conversations would need to be had with provinces and territories as well. We've worked really effectively and collaboratively with provinces and territories on, ensuring that we have an equitable framework for distribution of vaccines. And so I know the Prime Minister has met with the premiers yesterday. He meets with them on a regular basis. I meet with the ministers of health, and certainly everybody understands the principle that no one is safe from COVID if anyone is sick with COVID. And so we'll continue to have those conversations with provinces and territories as we move forward.
Thank you. We have about 10 minutes left before the ministers will need to depart for a vote in the House of Commons. Next question, please, operator.
Thank you. Merci. The next question is from La prochaine question est de Marie Vastel de Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour.
Yes, just a quick question, a technical one for Ms. Qualtrough or Mr. Duclos, I'm not sure. How much will the extension of the recovery benefits, the sickness benefits, cost? And how much will all this cost? I can respond to the question. It will cost approximately $12.1 billion. It's approximately $6.7 billion for recovery benefits and another $5.4 billion for EI. I don't have a follow-up. Your response was very clear. Thank you.
Thank you very much. There are no further questions in the queue. That concludes today's press conference.
Thank you. Merci. The conference has now ended. La conférence est maintenant terminée. Please disconnect your lines at this time. Veuillez s'il vous plaît raccrocher votre